Hi, my name is JP. I'm a student physical therapist assistant from CBD College. Before we start, can I ask for your name and date of birth, please?
Dominic Rice, June 16th.
All right, Dominic. So, what we're going to do right now is I'm going to teach you how to do a modified three-point gait pattern using a front wheel walker. So we're going to be hands-on. Is that okay with you?
Perfect.
All right. So before we start, I'm going to put this on you.
You got it.
All right. So. So to check if it's not too tight, you put 2 fingers in between the patient and the belt. All right, are you okay?
Mm-hmm.
Not too tight, right?
Not too tight.
All right, can relax now. So now I'm gonna teach you how to get up. So right hand on the chair, left hand on the walker. Lift your left affected leg, and on the count of 3, I want you to push with your right hand, right foot, and left hand. Right? 1, 2, 3. All right. How are you doing so far?
Doing good.
All right. So to measure the walker, if it fits the patient, all right. Put your hands on the side, please. So the handle needs to be aligned with the wrist crease. All right. So as you can see, it is. So grab walker again. All right. So the proper way to walk with the front wheel walker is push the walker first, step on your affected leg, which is your left one, and then your right foot. All right. Again. Left, right. Again. Walker, affected leg. All right. You can turn slowly. Also, how he's walking right now, like his back is like leaning forward too much, so you can correct that by like letting him know that to straighten his back. All right. All right. Back until you feel the chair behind your knees. All right, and once you feel that, try to grab the armrest, both sides, and all right. So now we're gonna do a passive range of motion Goni measurement for your wrist flexion. All right. So to start off, the fulcrum is gonna be the triquetrum, stationary arm is gonna be the lateral midline of the ulna, and the moving arm is going to be the baseline of the 5th metacarpal. Okay. Okay, so you have 75 degrees of wrist flexion, which is normal, because the normal range is 80. Okay, so now we're gonna measure your wrist extension. So let's just, all right. Here. All right, the landmarks, by the way, are for the fulcrum is the triquetrum, stationary arm is the lateral midline of the ulna, and the baseline of the 5th metacarpal is your moving arm. All right. One more time. All right. So you have 35 degrees of wrist extension, which is hypomobile because the normal range is 70. And so for the infills for the wrist extension and flexion are both firm infills. All right, so now we're gonna measure passive range of motion, wrist ulnar deviation. The fulcrum is gonna be decapitate here. the dorsal midline of the forearm is going to be our stationary arm, and the third dorsal midline of the third metacarpal is the moving arm. So now we're actually looking for a firm end feel there. All right. So you have 24 degrees of wrist ulnar deviation, which is hypomobile because the normal range is 30. Right. So again, for the wrist radial deviation, we're looking for an end feel as well. Fulcrum is capitate. Dorsal midline of the forearm is the stationary arm, and the dorsal midline of the third metacarpal is the moving arm. Right. You have 25 degrees of wrist radial deviation, which is normal because the normal range is 20. All right, so now we're gonna measure passive range of motion, ankle inversion. So the fulcrum is gonna be the talocrural joint, which is this one. The anterior midline of the tibia is gonna be the stationary arm. The second metatarsal is gonna be your moving arm, and we are looking for an end feel here. So firm end feel. All right. So you have you have 13 degrees of ankle inversion, which is hypomobile because the normal range is 35. All right, so now I'm gonna measure ankle eversion. So we're also looking for a firm end feel as well here. All right, fulcrum is gonna be the same. The talocrural joint, anterior midline of the tibia is the stationary arm, and the second metatarsal is going to be the moving arm. Right. Okay. So you have 10 degrees of ankle eversion, which is the normal range because the normal range is 15 degrees.
Good.
All right, so now we're gonna measure passive range of motion Goni for ankle dorsiflexion. All right, so we are looking for a firm end feel here. All right, the fulcrum is gonna be the lateral malleolus. Lateral midline of the fibula is gonna be the stationary arm, and the lateral parallel to the fifth metatarsal is gonna be the moving arm. All right, and then put it in neutral. So you have 18 degrees of left dorsiflexion, which is normal because the normal range is 20 degrees. Now we're doing ankle plantar flexion. We are also looking for a firm end feel as well here. Alright. Put it in neutral. And okay. So you have 30 degrees of left ankle plantar flexion, which is hypomobile because the normal range is 50 degrees. So now we're gonna measure passive range of motion Goni measurement for knee flexion. To start off, the fulcrum is gonna be the lateral epicondyle of the femur. The stationary arm is gonna be the lateral midline of the femur, and the moving arm is gonna be the lateral midline of the fibula. And you could use the lateral malleolus as the reference. For passive knee flexion, we're looking for a soft end feel right there.
Right, yeah. Oh, was it? Yeah. Oh. Yeah. You're like, let me get it.
All right, so
Yeah.
you have 139 degrees of knee flexion, which is normal, because the normal range is 135 degrees. Alright, so this time we are going to measure passive range of motion Goni measurement for knee extension. To start off, to get the best results for this one, you can use a bolster and put it on the distal part of the lower leg. Alright. The fulcrum is still going to be the lateral epicondyle of the femur. Stationary arm is going to be the lateral midline of the femur. And the lateral midline of the fibula is going to be the moving arm, using the lateral malleoli as the reference. You are looking for an end feel, by the way. Firm end feel. So you have 0 degrees of knee extension, which is normal because the normal range is 0 degrees.